You have to know though, thrombin and fibrin. That means prothrombin and fibrinogen. Prothrombin's activated to thrombin, which turns around and activates fibrinogen to fibrin. Fibrin is your clot. So you have to know 2 and 1. Of all those clotting factors, you have to know 2 and 1. 2 is prothrombin and thrombin, depending if it's active or inactive. And 1 is fibrinogen and fibrin. What's the other word for a platelet? Thrombocyte, right. Which enzyme digests clots? Plasmin. Which activator converts plasminogen to plasmin? So what I'm asking you is, who does this? TPA, tissue plasminogen activator. You guys will be involved in giving patients TPA at some point in time in your life as an IV or a shot. When you give TPA to somebody, it converts all of their plasminogen to plasmin. They digest every clot in their body. After you give TPA, you can't draw blood from them anymore. The doctor actually has to sew in a central line, sews it right into the artery, so the patient doesn't bleed, because if the patient bleeds, they won't clot. This is a very powerful, very, very powerful clot dissolving drug and anticoagulant. Anticoagulant because as soon as you start to clot, you dissolve it. And typically speaking, when someone's given TPA, it's not like heparin or Coumadin. When you give TPA, you can't even draw their blood anymore. The nurse has to draw it off the central line. All right? So you have to know plasmin dissolves clots. You have to know about TPA activating the plasminogen to plasmin. Which vitamin? Go ahead.
Oh, sorry. It was back to the blood. So if it agglutinates, it means it's having a cross reaction.
Right, a reaction. I wouldn't call it a cross reaction,
No.
just a reaction. Which vitamin is necessary for some of these clotting factors?
Okay.
Vitamin K. Vitamin K is necessary for the correct functioning of some of these clotting factors. Oh, I think I actually gave you this question once. Oh, I changed the answers, didn't I? Yeah. Well, let me read it to you. The following is a list of blood vessels and structures that are associated with the heart. What is the correct order for the flow of blood entering from the systemic circulation? So in other words, you got to be able to trace a drop of blood through the heart and blood vessels. So once again, you need to be able to trace a drop of blood through the heart and associated structures. So know the chambers, know the valves, know the major blood vessels coming out the heart. I'll read another question to you. The following are structural components of the conducting system of the heart. That means the SA node, the AV node, the bundle of His, the right bundle branch, left bundle branch, the Purkinje fibers. All that stuff, right? So it says this: the following are structural components of the conducting system of the heart. The sequence which excitation would move through this system is. Now you don't know how specific I was, right? Just like when I told you this was coming from putting air into the lungs, you didn't know how specific I was going to be. And you're yelling at me because I put alveolar ducts on there. Well, you don't know how specific I was, but make sure you go back and revisit the conducting system of the heart. What's a major plasma protein? The most abundant plasma protein?
Albumin.
Albumin. Which plasma protein is primarily responsible for blood colloid osmotic pressure?
Albumin.
Exactly. The most abundant plasma protein is albumin. The plasma protein most responsible for blood colloid osmotic pressure is albumin. Ooh, now I'm on immunity. You guys just took this. I would study the test you just took for some of these immune questions. Here's one, not on your test today. What do you call it when a white blood cell crawls out of the circulation and enters the tissue? Diaphoresis. What do you call it when chemicals attract white blood cells to an area of injury? Chemotaxis. I should just give you guys hundreds right now and not even take this. I'm kidding. Good idea. Okay, now let me tell you this is coming, but it looks like a different battery of answers. Oh, it can't be that much different. There's only a couple ways to say this. The following is a list of some airways. What is the order in which air passes through them? Okay, please go and look at that up this time, because I won't be giving you 2 points for 83% of you missing. Wow, I would study the test you guys just took a little bit. What's the normal respiratory rate of a non-diseased, normal statured, normal weight adult?
12.
I'm just making fun of Sam a little bit. Yeah, 12 to I think your book probably says 12 to 18, but I always say 12 to 20 breaths per minute. I'm done. What questions do you have?
Will we go over it that day or no? We probably won't.
Let me see. I will. No, here's what happens with the finals, just so you know. I grade them that day and enter your grade that day. So you guys can email me or come back and see me if you have any questions. But typically speaking, I give the finals to Ellie in our office, because you can come back and look at them. I have to tell her whether you can take them or not. I don't want you taking them. Ellie keeps them on file for forever and ever and ever. But you can come and look at them. And the reason I give them to Ellie, because she's here over vacation and I'm not. Let me just be clear. I'll be in England from December 26th to January 3rd. Don't expect to get a hold of me. Don't email me.